just got a DUI this morning, right? Like since we've been at school.
Oh, wow. I'm not right, I can't eat one of those.
Oh, no, whatever.
So he was drinking for breakfast then?
Hey, that's what we call breakfast of champions.
That's what it is?
Yeah.
Well, sorry.
You. Not me, but you. Oh, right, okay, gotcha. Well, anyways, check this out, like the dentist office, so, they finished my exam and everything, and this guy, he's like, what's your name? And I said, it's Michelle, but his name was Cheryl. And he just gives me the top chart, and hands it to me. He says, take this up front, and I'll just go over your, this room, making sure this room, okay, you did chart this room, you can for your next visit. So, I'm waiting for the lady to get into the office, and I'm looking at this stuff, and it says, Sharon Flores, has, next page has hepatitis, herpes, TB, and something else, but I couldn't read in time. And as soon as I saw it, I thought, this isn't mine. So I took it to the front desk and I said, this isn't my file. They're like, oh, really? I said, yeah, really. And now I know the person that I just looked at their file, and I almost said the name out loud. But for some reason I just didn't. I said, now the person's file that I was looking at, and I thought, more into what I was saying, that now I know they have certain things. That's how I left it. The person was sitting in the waiting room because they called her right after I gave them back the paperwork. And had I said her name, she would have known I just saw that stuff in her file. And he just went, oh, and he put it back. And I thought, that's a severe HIPAA violation. He handed me someone else's file. That guy should have asked me, is your name such and such? Not just handed me the file.
He did, and he still gave you one.
Well, when I told him, he came back out. I said, you handed me the wrong file. That wasn't my file. And he goes, oh, really? It was on top. I'm like, but it wasn't my name. He just saw SH, I think, as first name. And when I said, oh, it's Sheila's first name, and he just saw SH and gave it to me. He gave it to me. It's like herpes and TB. So I'm upset because you know how you have to say your cat and any of those and all this stuff because they're working on blood around your gums and everything. And I was just like, oh, yesterday.
I wonder if some people have something else.
I don't know. I haven't ever had anything, but when I sat there and I'm like, when I saw herpes and hepatitis, I was like, this is my fucking file. And so I flipped back to the front page and I was like, okay, Sharon Flores. I'm like, I don't know, Sharon Flores. Because now I know her conditions, but I was like, holy shit, man. I know. So I was kind of like, wow, it sucks.
That was great. Oh. You seen those pictures of herpes?
No, I don't want to see because I did my project and created everybody out with one of the pictures I did. It was covered. The whole thing was covered. Warts. No, it was warts.
You can get rid of those.
All I know, but it ate up all the skin, it ate up her legs, everything. I mean, yeah, but my whole thing was like that's how I end all my PowerPoint projects. We have our things we have to do, and so I would end it with really like sicko pictures, just like weird, like oh, that I clap and everything.
Yeah, but herpes is like one of those. Herpes and AIDS to me is like the worst thing in life.
But you know Hawaii is the number one state for herpes. Like 7 out of 10 people with Hawaii.
I can believe it because people come out clinic with it all the time.
Yeah.
They come in with it, or either they either come in to get diagnosed, or they come in because they have outbreaks, and then they just come in for something else, and then you can see their records. Just anybody that comes to my clinic, I can see all their
It
records.
was like us and looking in the room, and I'm like, because these people are lying, so there's a good chance if 3 or 4 people I said in class would have it.
I don't even have one or two. I never even had
Yeah. No, I remember having anything. I never even had a yeast infection. No. The only thing I've had, and I had it just for the first time this year, was a urinary tract infection.
You're lucky not to have yeast infection.
I know, I hear this, but you know what?
I used to, if you douche a lot, you get, I didn't know that.
Yeah.
I used to douche like all the time because I thought that's what you're supposed to do.
Yeah.
And
But you
I
can mess
forget.
up your own body.
Yeah, but I didn't know
had
that.
bacteria
So I went
infection
to-
from that.
I didn't know, so I went to the doctor. Because I used to be like excessively clean, like, I mean, to
Because
the
you're
point
really
where,
making yourself dirty.
yeah, but I didn't know. I used to clean myself like every single time I used the bathroom, I clean myself. Every single time.
Yeah.
And every time I used to do the douches too, and then I used to wash all the time and take showers like all the time.
Yeah.
Like, and then the doctor was like, why are you doing that? And I was like, I want to be clean. And I thought that was what you're supposed to do. So I was like, clean, and too clean that I would wash everything away and then I get infection.
Yeah.
So
Well, I had
to
my,
stop doing it.
not my last tap, but the one before that. The doctor called me afterwards, and, because during the exam, everything was great. And she comes, she goes, "Do you itch?" I said, "No." And she said, "Well, she goes, you douche a lot, don't you?" And I said, "Yeah, after sex." And she said, "Can you stop that?"
Yeah,
She's like, "You can't do it at all." And I said, "Why?" And I'm thinking, "Oh, that's gonna be gross, you know?" And she put me on medication, and it didn't change me, but I had bacteria, and I didn't know about it, and I didn't have any infections. It was just bacteria in there. And so after I did the first round of it, the medicine, she said, "Don't ever do it again." And I didn't do it for at least a year. And then, I forgot, I think after a year, I've done it twice since then. But like the first time, maybe I just didn't feel clean. And I was like, "Oh, this, you know, it's been a year. I'm sure I'm not gonna mess up my system over, you know, after a whole year." So I did it, and then like, Adam and I, when he first came back, we had like been together all weekend long, like at the end of the week, you know, shit out of me. And it's just been since then, but that's been it.
Yeah,
But
I used to do that all the time.
I used to do it all the time too. My doctors used to always tell me to stop, but they never like explained why. They just said, you know, they just said, "You don't need to do it that often." And on the box,
washing
it
your
says,
natural flora that
yeah, well,
it's
now
certain
I-
bacteria that's supposed
now I
to be
do
there to
that.
fight stuff.
yeah, now I do that. I didn't do that back then. And I was like, "What the hell?" But they just used to, all my paps always say, "You need to quit doing this so much." And but they never said, because your body takes care of itself.
Yeah.
So, but but this now, but it's kind of funny now, because now even after my cycles and stuff, everything just naturally, I go back to normal and I'm okay. And see, before I always did that in my cycle, always. Because that just made me feel better, like, ooh, I had my cycle.
I don't know how it works for me.
I'm looking forward to that day coming, but actually I don't
I'm
have
so
that
happy.
cycles. I don't even get cramps anymore. I
I
have
don't
a
even
cycle.
get cycle at all. I don't have to bottle nothing.
I do. I get, for the first day, I have my cycle. And then I have another day, but it's not being like hormonal period. It's just like that last day of like the whole
It's
cycle.
so glorious, man, with cycle and not
Yeah,
being
and I don't want to go
menopause.
through menopause though.
I'm not in menopause.
Have you not had a cycle?
I got a history.
Wow. Damn. Yeah, I would love to.
It's wonderful. It's like,
I'm getting ready to hit menopause, man. I'm 44, so in like 3-4 years, I'm
oh,
gonna
you're
be
in
there.
menopause into your 50s, brother.
I'm not looking forward to that, because I'm not looking forward to the hot flashes. But I'm gonna be one of those people. I'll go be one of those people that get the hormone rub, the
But you
creams
know what
and
the-
stuff that match
One
your
of the
body
ladies at my work,
perfectly.
she said she went through menopause, but she didn't have any issues.
Some people don't. I thought I was going pre-menopause because I was getting hot, like I thought I was getting hot flashes, but it turned out it was a medication I was taking caused you to sweat. So,
Oh.
yeah, it was actually a pain pill I was on, and now I don't, I just took that pill. But.
So what you think that nurse is gonna be feeling stupid? Huh?
Yeah, well, he didn't even feel stupid.
Yeah, because he
But I was
did.
sitting there, I'm like, thank God I didn't say that
Oh no, I'm
woman's
talking
name.
about the one that was doing that stuff to me.
Oh, yeah. I don't even
Yeah.
think at the clinic. I
Yeah,
don't know.
crazy. You a nurse, right?
No.
Hey, what happens, like, I had a
Don't
thing
you?
at the
No.
dentist yesterday, they handed me somebody else's file. And I didn't, the front, I just looked at the front barely and I opened it up and I saw this person had 3 conditions that she would not want anyone to repeat, right? And I went to say, you handed me so-and-so's file. And I was like, you handed me the wrong file and now I know this person has these things. She was in the waiting room. Because her and I had finished back to back and they handed me her file.
Yeah.
And he was like, oh, don't they have to disclose that to HIPAA that that they gave someone else the file.
They don't have to disclose it, but you want to report it to whoever the supervisor is,
Oh.
right, who handles confidentiality, so they can kind of train or remind people about handling of medical records.
Well, the
That's-
guy had asked my name, back when they were finishing my clean, he said, your name, and I said Michelle, and I said, but it'll be under Sheila as the first name. And he hands me the file, when I told him he gave me the wrong file, he goes, oh, that was the file that was on top. And I'm like, should he put the damn name before he handed me someone else's file? And it just so happens, the reason I know she was in the waiting room is because they called her, like, I was waiting on them to work up the amount it's gonna cost me for what I want done. And she was waiting on the same thing, so they called her name, and I was so thankful I didn't say her name out loud when I handed them back the file. Because if I had those things and someone saw my file, oh, I'd be
I
pissed.
swear I thought she was a nurse, Sarah.
No
Never been a nurse.
nurse, no MA, no
It was
nothing.
at
What's
the
her name
dentist
then?
office.
Sharice.
Sharice is, yeah. Sharice
Okay,
is.
maybe that's one.
It was at the dentist office, but what's it, Aloha, no, Ala Moana. Ala Moana Dental?
I had this issue at work,
Wow.
Sarah.
I know, and it may be just the
This,
guy who's new.
This nurse kept trying to make
Because
me
he
do a
kept going, it
nurse's
was on
job.
top.
No, that's
And then,
Chad, isn't it?
So the nurse was trying to get over on me and stuff, the other nurse, when that he was trying to make me do a job.
It's got light color
And
eyes
then,
around here.
so
Yeah, that's Chad.
I told her that I didn't appreciate it and she
Oh,
needed to start doing her job, you know, because she kept
Yes,
pushing on
space
for me.
between my two front
Yeah.
teeth.
And he tried that because he was head nurse, he tried to say he can
That's
put me
very
in that
odd.
spot.
I thought they don't have.
And then, so I had already told my
She might have
supervisor,
been a new person.
and my supervisor, had already talked to
I
like
said, "Is
the
that
OIC,
you?"
the head person.
Yeah, because they're just
Yeah.
all
And then-
computerized.
Yeah,
So he tried to get crazy with me at
and it
work.
was my initial.
And I was like, he tried to tell me to write me up. I said, do what you gotta do, right?
Who's
You
your
gotta
doctor?
write. I said, you should go talk to my supervisor.
Yeah,
and I already
I
talked
love
to
him.
him. And
He's really
then,
good.
Yeah,
so
so I
Come
go
to
in
find
Monday
out,
morning at 8 and get.
he tried to write
space
something, but he
in
wasn't
front
able
and back
to
of
get
my
anything
teeth
written on me
down.
because he can't make me go outside of my,
Because I had a tooth
scope of
a few
practice.
years ago, so my teeth are spreading.
You know what I mean?
Yeah.
And now it looks like I have like.
And that's what he was trying to do, he get me to go out of my scope of practice and he
Starting to
can't.
spread, you know? So
Yeah, you
pictures looks like I
can't,
have stuff in my teeth.
Do that. They gotta be cautious because you
But
get
they
in trouble.
recoded it so that my insurance would pay for it, but I have to pay $131 of that myself. But at first it was gonna cost me $600.
Yeah.
And she goes, let me recode it and see what your insurance will pay. So she put it in a different way, and I have to pay $131.
We have this drug
Yeah,
that's
they're
trying to
really
get
good
last
about
night.
finances.
Yeah.
At where?
At our clinic, she got you know what sole provider is, right? You know what the code sole provider is, right?
Sole provider.
Sole provider, that means like, if you see, let's say for example, she come to my clinic, she said, oh, I got a fractured, ankle. So I was like, well, how do you know your ankle's fractured? She said she went to Triplet and they already diagnosed her with a fractured ankle, right? So I said, so exactly, what is it you want from us? I said, I don't understand, if you already know your ankle's fractured, what is it you're looking for? You know what I mean, you already got the diagnosis, what do you need from us?
I usually start.
So she says,
And I
oh,
end with this.
well, there's no improvement in my ankle, this and that. I was like, okay,
Yeah.
so
Go with the easiest so that you feel.
I tried to check on her,
And then
right, so I
test
asked if she had any
yourself.
allergies.
Oh.
So I go
That's
and
fine.
click under allergies, and then the medication that she's restricted from came up on the screen.
Whatever works
So
for
it's
you.
Valium,
It's not working.
Valium, Adderall, Oxycontin, all these drugs, right? She's addicted to it. She got a sole provider, so she can only
But
get
I
from
mean,
that
if you get
person
stuff, I say
a set amount each time. She had just got medication yesterday, the day before, you know, like it was the 29th yesterday. She just got it the 28th. And she told me she was out of the pills already. So she tried to come to our clinic, bypass her provider, when everything's still in the it's still in the computer.
Yeah.
No matter where you go, it's in the computer. As sole provider, so I highlighted all the medications that she was restricted from. And she tried to get those medications when she got to the back. And I went back to the doctor and I said, did you look at her file? Did you see where I coded that
Yeah.
she had already been restricted from the medication? She was saying, oh, and then some medication was Q12. She said she on the 28th got it and she was done with it on the 29th.
Oh, that's fast.
Whoa. Every 12 hours. How you wanna use 10 pills in 12 hours and you only had one day?
No, I couldn't see her.
She's seen it.
Yeah,
So he told me he had to go back to the provider. I was mad, cause you know
It's the end of
you gotta go
July.
back to your provider. That's on Monday. You try to get drugs.
You too.
You know?
You get your drivers. Yeah.
She don't like you.
Like me first.
I remember that.
Look, my son's birthday was July 8 is my doctor's birthday. Oh, back one copy.
I know
Two
the
years
doctor's
old.
office might not be out there. Guidelines for his son.
Maybe this
You
is
have yourself.
I can walk
The
around.
doctor.
Oh.
Come back then.
Oh, I think I read.
Thank you. I figured today you right there. And you get the class. Yeah.
I know.
And you can be that way.
And I know, yeah, right in here, they right in here, then put him here.
No matter you go there.
And it becomes paper.
Yeah, I actually get $44. Oh, we don't go enough
Yeah.
to.
So that was
But then next time we get to 44 times 6 kids.
I
Yeah, I always get the discount. This is really $20. Yeah.
You did it on there?
Or I can go to my bank. Yeah, you put it on
Run
the
away, that's all.
That is so freaking much.
Made them long. Sorry. But milk also. What did I see? We were talking about math last night.
Okay. Oh, you know today when you highlight. Oh, you saw my colors. You go further down here. Yeah. So they're gonna speak. It's not too bad.
We went to church. Oh, I did
I'm just like, I just see her in the back of me.
Yeah, I want to take the speaker. So, yeah, the one day he was teaching about, you know, how they say rich people going to hell, right? But those are people, you know, stop it. That's really why they say that. You know what I'm talking about? I said, good, he was good.
It's my favorite.
I got his son,
You get mad.
and then he goes around and preaches everywhere.
That's
Yeah.
it. Under.
Oh, I know, Father's Day, Sunday, church. Now I watched it online.
What about the other?
I sort of see your boy from this. I was like, I don't know.
It's a different, yeah, program.
Yeah, they have like pages, which is hard, and then they have something else, which is.
Pages, no, the believer, even the Big Bang. But I pray for him. I don't know how our hearts can be from one dust in the dirt.
Alright.
What are the rest of the people then? When's everybody else coming from the dirt?
Yep, alright. MRSA. Methicillin resistant Staphylococcus aureus condition. So, when a patient is diagnosed with an infection that is due to MRSA, and that infection has a combination code that includes a causal organism, assign the appropriate code for that condition. So, you're going to code either 03812 or 482.42. So, if a patient is diagnosed with an infection that is due to MRSA, MRSA is basically methicillin resistant Staphylococcus aureus. If that's the case, then you're going to code 038.12 methicillin resistant Staphylococcus aureus septicemia, or for like condition codes, or I'm sorry, sign appropriate condition code. So an example like 038.12 or 482.42, which is methicillin resistant pneumonia due to Staphylococcus aureus. So what there's what these two examples is that the patient has the underlying condition, right? So the septicemia with the MRSA. So what they're saying is, if you have an infection that is due to MRSA, and when you look for the code, and the combination code means it's one code that identifies both the infection and the MRSA, you're going to code using that one code. So it doesn't matter what the infection is, but if the infection is due to MRSA and the code is a combination code, it includes both the infection and, in other words, you're not gonna have two separate codes, you're only gonna have one code, right? You're gonna code using that one code. Don't use two codes, like the 0412. 041.12 is methicillin resistant Staphylococcus aureus. You're not going to use that and a combination code because a combination identifies infection and also the fact that it's MRSA. Okay, so in other words, if you code twice using 041.12 and a combination code that includes it, you're basically describing it twice and they're saying you don't have to. So if you have an infection and it's due to MRSA, you only need one code. If it's a combination code, use that one code. So the example they have here, patient presents to the hospital with a high fever, pneumonia is identified on a chest x-ray. Sputum cultures are positive for MRSA. On the discharge summary, the physician documents the patient had pneumonia due to MRSA. So when you look up pneumonia, and you look up pneumonia and it says due to MRSA, the one code 482.42 identifies that they have one pneumonia and two that is due to MRSA. That's what this guideline is saying. Though if you have an infection and the MRSA, one code describes both, you use that one code and you don't have to use two codes.
Is it always gonna have MRSA always gonna have one code? One combination code, or sometimes it'll be two?
Sometimes it will be two. That's the next guideline.
Oh, I'm sorry.
But they're saying that this one, if you have a condition due to MRSA, when you look up the diagnosis code and there's one code that describes both, then you use that one code, okay? You don't need to add 041.12, okay? So you're basically repeating yourself again, okay? Okay, so do not assign MRSA as an additional code because the code includes the type of infection and the MRSA. Such as this example, pneumonia due to MRSA 482.42. Do not assign a code from category B09.0 as an additional diagnosis also.
What is B9.0?
I have no idea.
Okay.
I have to look it up. Okay. Other codes for MRSA infection, when there's a documentation of a current infection due to MRSA and that infection does not have a combination code that includes a causal organism, select the appropriate code to identify the condition along with MRSA. So let me give you an example.
MRSA, that's common in hospitals, yeah?
Okay. So this is the situation. Infection due to MSRA, that's a methicillin resistant Staphylococcus aureus. If there is a combination code when we talk about the guideline, is one code that identifies the underlying disease and the manifestation, or two different conditions, or the disease and then the signs and symptoms. Okay, well, if it's a combination code, you're going to use a one code. So in this case, with the pneumonia due to MRSA, one code describes both the infection and the MRSA, I spoke wrong. 482.42. If there's no combination code, then what they're saying is you're going to use two codes, one to identify the infection and the other code to identify that is due to MRSA. So the 041.12 is your due to MRSA. Okay. So let me read this. When a patient is diagnosed with an infection that is due to methicillin-resistant Staphylococcus aureus, MRSA, and that infection has a combination code that includes a causal organism, like Specipia pneumonia, assign the appropriate code for the condition. So for example, 03812 methicillin-resistant Staphylococcus aureus septicemia, or 482.42, which is methicillin-resistant pneumonia due to Staphylococcus aureus. That's an example. They have a note here, it says, do not assign 041.12 because that code identifies that is due to MRSA, but your one code already includes it, so you don't need to repeat it again. Okay, when there is documentation of a current infection due to MRSA and that infection does not have a combination code, and that includes a causal organism, select the appropriate code to ID the infection, so the pneumonia, and then 2 will be the 041.12 because that means that the MS is due to MRSA. But because there's already one code that includes both, they're saying just use a combination code. Okay? So first again.
And on the bottom where it says do not assign a code from the B09.0, we can't assign that with the 041.2 yet. That's what you're saying? Or no?
Don't assign it with the combination code, even with the 04112 also. Yep, do not assign. So even for both, they're saying do not assign. If it's due to MRSA, whether it's a COM code or a single code, do not code 09.0 infection with microorganism resistant to penicillin. Because that's what MRSA is. It's just more specific. It's methicillin resistant.
Because it's a typo penicillin, right?
This is a different type. Yeah, it's a different type. So I guess if there's something more specific,
Yeah.
then you can use this.
Okay.
Okay, so basically some terms you need to know: colonization, whether it's MSSA or MRSA. Basically, what it is it's present on or in the body without necessarily causing an illness. So you can have MSSA or MRSA present on or in the body, but when it doesn't cause an illness, it just means colonization. It's hibernating, basically. So positive MRSA colonization test might be documented as a provider as MRSA screen positive or MRSA nasal swab positive. Assigned code VO254 for patients documenting to having MRSA colonization. So it basically means that they have MRSA or MSA on or in the body, but it's not causing any illness to the individual. Okay, so if they have it on or in them, no illness, depending what type it is, MSSA or MRSA will determine which code you're going to use. VO254, which is the MRSA, and then VO2.53 is your MSSA. Okay, so methicillin-resistant Staphylococcus aureus is VO254, and let's see, methicillin-susceptible Staphylococcus aureus is VO253. So you need to know what colonization means. And once you understand what it means, then you'll know how to use the VO254 and the 53 depending on which one they have, susceptible or they have the resistant. Okay. So first degree?
Yeah, so
Yeah.
Colonization not necessarily indicative of a disease process or as a cause of a specific condition the patient may have unless documented as such in the provider. So code VO2.59 should be assigned for other types of staph colonization. So they don't have the MSSA or MRSA. If it's something else, but they still have it on or in the body. It's not affecting them. There's not causing an illness, but they have something other than the susceptible or the resistant VO259. VO259 should not be assigned for colonization with any type of Staphylococcus aureus. Okay. And then last one, if a patient is documented as having both the MRSA and an infection, they're saying at the time, if they have both at the time of admission, you can code for the infection and code for the colonization, the VO2.54. Okay. So if a patient is documented as having both MRSA, colonization, and infection during the hospital admission, code VO254 carrier, suspected carrier of methicillin resistant Staphylococcus aureus, and also code for the MRSA infection, may both be assigned. So this last example, patient presents to the hospital with abscess in the buttocks. The culture of the abscess is taken as well as nasal swab. The culture returned positive for MRSA as well as positive nasal swab. The physician documents that the abscess is due to the MRSA. So 682.5 and then the 041.12 would be the MRSA. So there's no combination code for abscess due to MRSA. So you have to use the infection. What's the infection? Right? Then you use the 041.12 to indicate that it's due to MRSA. And then you have your VO2.54 to indicate that that colonization. Okay. Any questions?
When you say combination, you mean like MRSA and something else?
Yeah.
Combination code, you mean? Meaning you identifying with one code the infection and the MRSA is one code. Right? So one code 421.67 is the infection plus due to MRSA. It's all in one code. If that one code does not describe the infection, then you have a code for the infection, which is the buttocks thing, what was it? Abscess. This is the abscess, and then this is indicating that this is causing the abscess in the buttocks. So no one code is identifying that incident or the scenario, so you have to use two separate codes to explain. That's what they mean by combination code. So in that case, if you have one code, you don't need to use this because that combination code already includes it. Okay. So first you're good? Yeah.
And you come my age.
I like some numbers, yeah.
All right. So
That's it.
In a jackass right now.
What is the professional word for that?
Donkey.
I was on my mind, but I didn't want to say anything. No. Okay.
Mule.
Anus.
Can't work.
Okay. All right.
It is.
Let's do professional.
So that is the professional medical terminology for buttocks. Yeah,
Oh yeah, but.
not anus.
All right.
Doctor. Is she still teaching here? Dr. Jones?
I think she's on a trip. Oh, she came back. Oh, she comes back tomorrow.
Oh, cool.
She's in Samoa right now.
Oh, interesting.
No way.
Yeah,
For what?
some of the church.
Oh, good.
That's nice. So late.
Churches do that though. Well, some more.
Okay, I did the church's convocations. To take my trip.
Yeah, but you working in church.
Churches to go to.
I just. I'm not gonna open the can of worms. I'll get in trouble. All right, let's do okay, some exercises. Let's do the at the end of chapter 9. Actually, let's take that.
The chapter review exercise?
Yeah, but I want to get some examples, do some of what we just did, some of the,
That would really help us out, Sarah.
The chapter review.
yeah, let's do,
Like, seriously.
Can we do some from our homework?
I'm trying.
I get lost.
I get lost.
Okay, we all got this.
I know.
I was like, wait, this wasn't in class.
I need to give you some.
Huh. I was really excited to tell you all. What are you?
Change your number,
Can I tell you what time you do homework?
That's your notes.
Come on. Don't you work at the thing. Okay, babe, what? Okay.
She does it while you're working.
It's at nighttime.
Do it when you start.
All right, let's go to 229.
I'll just do what I can.
Exercise 92.
My thoughts will be from the chapter review.
92.
Yeah.
92, let's start, we're gonna do 9, 12, 13, and 15. Exercise 92, we're gonna do number 9, 12, 13, and 15. The reason I selected these because they have guidelines and I wanted to start thinking about, yeah. So I'd rather do practice on those. Everything else are pretty easy, straightforward, but